Carnivore is part of a battle against, I think, a medical system that's broken, a food system that's broken, and a misplaced environmental stance.
Dr. Rick, how did you find Carnivore?
Well, Dave, it's been actually a lifetime journey. So I've been obese and not obese throughout my life. And somewhere around the time I was probably 12, I can't remember exactly, my mom had me on the Atkins diet. And, back then the Atkins diet was super radical. And I can remember her making me egg bread and things like that. And, I didn't like it, but it really worked. So the summer between my eighth grade year and my freshman year in high school, I did the Atkins diet. Now, my middle school years were pretty rough. I was the fat kid. I played football, but I didn't play much because I was too fat to really run very well. And it was really rough socially. And so I did the Atkins diet in between my eighth grade year and ninth grade year. And I showed up to high school looking slim and feeling good. And that year I started wrestling. And so I wrestled through high school. And we went on what you call the don't eat and wrap yourself in plastic and run diet. So even in the times of year when I was in really good football shape, I was weighing about 180, 185. But I would get down to my junior year, I wrestled 141 pounds. My senior year, I wrestled 148 pounds. And when I started the carnivore diet, which I'll square the circle on the story. But when I started the carnivore diet this January 3rd of 2024, I weighed 280 pounds. So 100 pounds more than I weighed in high school. And in the interim of stopping high school wrestling and going off to do normal college things and drink beer and eat pizza, I gained 40 pounds my freshman year in college. And then I didn't at that time use low carb or the Atkins diet. I just went back to super food restriction. Then I went off to medical school and I had gotten myself back in shape. And then I went back up another 40 or 50 pounds. And again, at this time in my life, it was relatively easy to just work out and eat less. And I didn't know anything about metabolic health. Nevertheless, being a medical student, I'm not sure metabolic health was even a term that was used when I was in medical school. I mean, there was cardiovascular health, and there was other pulmonary health and different kind of broken down into organ systems, but an overall health of how is your body doing metabolically was not something that we were taught in medical school. Had my nutrition course in medical school, didn't really didn't vary much from whatever all the other doctors are saying. The food pyramid was coming in, and that was the thing, and diabetes was something that was never curable, and the obesity crisis was just because portions were getting bigger, and all of the simplistic thinking that we were taught at that time. But when my weight ballooned back up in medical school, I did the zone, and then after the zone kind of didn't really work for me, I finally did the Atkins diet again because that was what I knew, and it kind of got down a little bit. Then I went off and did my internship in general surgery in Hawaii, and I was not eating good at all, but I was surfing all the time, so my weight stayed okay. Then I went to New York City to do my residency in orthopedic surgery, and I actually lived on the beach, and there actually is surfing in New York on Long Island, and so I was surfing a lot again. So I didn't really need to do much more than just cut back a little bit when it was time to lose some weight. And then when I finished, I went and I did a fellowship in Australia, and I did a couple fellowships in Australia. and pretty well kept my weight because, again, I was surfing all the time. Then I moved to Hawaii for 10 years, and that's when things started to slow down, and the surfing wasn't enough to overcome the eating. And I got into eating. Hawaii is an amazing fusion of different cultures and different foods, and they've figured out how to pack an enormous amount of good taste into meals. And I was a sucker for all of the good Hawaiian stuff. I still love it, but if you go to a party in Kauai where I lived, you get a big plate and you might have some pulled pork over on the side. Then you're gonna have a macaroni salad, you're gonna have a potato salad, and then you're gonna have a big clump of rice. Or one of my favorite dishes is what's called a loco moco, which is a big round scoop of sticky rice with 2 hamburgers, 2 fried eggs, and gravy. So I was eating all that stuff and I just ballooned up. So then I did Body for Life, which is 6 meals a day and super intense exercise. And it worked, but I couldn't maintain it. I mean, it was really intense, and you had to carry your meals around with you all the time because you were supposed to eat every 2 or 3 hours. So there was so much prep work and everything, and so I finally fell off of that and kind of stayed heavy for the next 6 or 8 years. I was surfing less. I had a couple of kids, and then I went to, Champaign-Urbana for a couple years when I left Hawaii, and there I did a thing called Ideal Protein. And Ideal Protein is a diet that is you take 2 little snacks per day, and they have their own snack formula, and then you would eat 12 ounces of meat at night, and you could have some vegetables with it. But in the end, it was occasionally ketogenic, but highly, highly caloric restricted. And so I was able to lose a lot of weight, and I just was tired, exhausted all the time. And I look at the pictures of myself from the time, and I was slim, but I wasn't a healthy looking slim. And I actually just the other day, by the way, got my weight down to where it was at the lowest in my adult life, right when I was doing the Ideal Protein. But this time I'm building muscle at the same time. So so I kept going, and then I kind of had given up a little bit. And now that I'm in my practice here in Iowa, and I got to the point where about a year and a half ago, I felt absolutely terrible, sick, very sick, very, very stressed. Went and had some cardiac studies, actually had a CT angiogram, which, for the viewers who are not familiar, a CT is a multi-directional X-ray. You go lay in the tube, and they take X-rays from multiple different angles of your heart. And an angiogram is where they inject dye. And so the CT angiogram tells you whether or not your heart vessels, so the coronary arteries they're called, have any clogging in them, or arteriosclerosis. Sorry, atherosclerosis. Arteriosclerosis is the hardening of the arteries. So I did, and I didn't have much, and meaning I had 1 to 24% clogging in one of the not main arteries. And so my cardiologist at the time, I then had a stress test, and that was perfect. My cardiologist says to me, "Keep doing what you're doing. You're doing great." And so there I am, my cardiologist having told me that I was just to keep doing what I was doing, but I'm at least 50 pounds overweight. My fasting blood glucose was over 100, about 107. So I qualified for prediabetes. And I didn't know it at the time, but I had sleep apnea. So my wife and daughter kept telling me, "You snore so bad. We can hear you." My wife would say, "I can hear you." My daughter would say, "I can hear you in my room." So I said, as bad as I feel and as obese as I am, maybe I have sleep apnea. So I went to get a sleep study, and lo and behold, I was waking up 17 times per hour. And I was either waking up or my oxygen saturation was going down 17 times per hour. They give you the number of, they combine those numbers. So you either wake up or your oxygen reaches a certain point, how many times an hour. So it was 17 times an hour. So they said, you need CPAP. And they told me in the sleep study, so after the first 2 hours, they woke me up. I wasn't even really all that asleep because I didn't really sleep back then because I was waking up 17 times an hour. And they said, you didn't even get into stage 3 sleep, let alone stage 4 or REM sleep where you're dreaming and you're deep, deep. And then they put the CPAP on me and I went right into stage 4 sleep. And that started my whole real way of reclaiming my health. So then I bought a mountain bike, an e-mountain bike, and I said, all right, I'm gonna get really in good shape. And so, because I was really starting to feel a lot better than I did. I was still 50, 60 pounds overweight, maybe 70. I'm not sure. I don't know how many pounds overweight I am until I get to my ideal weight. I'm thinking I've got another 25 or so, and I've lost 43. But so I get to the point where I'm riding my bike 6, 8, 10 hours a week, and I'm in the gym 6, 8, 10 hours a week, lots of working out. I'm eating keto during the week. And then I'm doing essentially low carb on the weekends, and I am not moving the needle. I get up to about 270 pounds on the weekend, and then Monday morning I'd be 270, and then by Thursday, Friday, I'd get back down to about 262, 261, sometimes 260, and then right back on the weekend. And I did that for about 8 months. And then, I had listened to Jordan Peterson a fair amount over the last few years, just not for health reasons, just because he had some brilliant, brilliant takes on things. And so I listened to his story about how it healed his health, and then Joe Rogan started talking about it, and so I said, well, let's check into this carnivore diet. And so I decided that January 1st of this year, I would start carnivore for good. So I went to Hawaii over Christmas, as my family often does, because we have dear friends who are still there. And I went and ate all my favorite Hawaiian treats and got up to 280, which tied my highest weight ever. I took some pictures. I bought a camera and I came home and started carnivore and started a YouTube channel. And this whole transformation it's been a complete life transformation for me because number one, I'm the healthiest I've been in forever. I had metabolic syndrome. And so metabolic syndrome is five criteria, and it's essentially high triglycerides, low HDL, high fasting blood glucose, high blood pressure, and a waist over 40 for men or 35 for women. And I had three of those. I had the waist over 40, and I had the blood pressure. My blood pressure was sky high. It was on two medications. It was in the 190s over about 110, and you should be 120 over 80 is normal. So that was just crazy high. And one of my very best friends from medical school died my age, 53, 54, died last year of a stroke. And so all of this is happening all at once. And I'm like, okay, go carnivore. 3 months in, I'm 30, 35 pounds down. I'm I'm 4.5 months in and I'm 43 pounds down. My blood pressure is normal. I'm in the 120s over high 70s, low 80s. So I no longer have metabolic syndrome. And I feel the best I've felt in forever. I feel like I'm in my 30s. And so it's just been this crazy transformation. And so, my family history is deep with obesity. My brother, who has passed away in his 50s from a gastrointestinal related cancer after he had had a gastric bypass. He was obese his entire life, sometimes severely obese, sometimes not, but always way, 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 way past healthy. And so he had a gastric bypass and then developed a pancreatic related cancer and died from that. My father died from cancer, but he had diabetes the last 10 or 15 years of his life. And so when you're thinking about carnivore and you're doing the carnivore diet, being a physician, I start thinking about, I have a degree in biochemistry, so I'm thinking about the biochemistry of it. I'm thinking about the implications for me. I'm thinking about the implications for my family, for my patients. I've always had patients who I wanted to do surgery on them, but you just couldn't because it wasn't safe. Very early on in my career, orthopedic surgeons have known for a long time that if you have a body mass index over 40, and this is sort of an index of your height over your weight, and it's not perfect, but it's sort of a framework we can work with. If your body mass index is over 40, you have a higher chance of getting infected from a knee replacement. Well, I had this very obese woman who literally was crying in my office and begging me to do her knee. And she was mildly diabetic, but not too bad, but she was obese. And she was like, I just can't do it. I have to exercise. I can't lose weight. So I did her knee replacement and she ended up with an infection, and those can be catastrophic. And she had just a terrible, terrible outcome. And so I started to get real strict. It's very hard because a lot of times the patients will really push and say, well, I can't exercise because I have knee arthritis. And so, but I really need this knee replacement. So I've always been looking for ways. And I was always telling my patients, well, go low carb, eat less, move a little bit more as you can. And not very many of them were very successful at all with it. And so as I've gone through this transformation myself, I've really been diving into the medical literature, and I started looking at metabolic health in general. And so, I wanted to be sure, well, if I have a patient and I tell them to try the carnivore diet, is their LDL going to go through the roof? Is their primary care doc going to kill me? And so I really started looking into it, and I looked into Nick Norwitz's meta-analysis, which is a study of studies, which showed that class 2 and class 3 obese people, when they go on a ketogenic diet, don't necessarily have their LDL go through the roof. So I said, all right, well, now I feel good. And I talk to the primary care doctors and I say, listen, I want to talk to this patient about a carnivore diet. And really recently what I've found, most of the doctors say, listen, if you can do something that's going to get my morbidly obese patient in shape for a knee replacement, do it. So I've found a really receptive audience in where I am practicing. So I started recommending the carnivore diet to some patients, and some of them have done very, very well. It's very early because I didn't really start recommending it until maybe 6 weeks ago, because I was still tracking my own progress, doing a lot of research, trying to figure out, is this going to be something safe? What if the patient has some renal failure? What am I going to throw this patient into a catastrophe? And what is the primary care doc's going to think? So I kind of got over that hump, and now I'm recommending carnivore to my patients to get to a target surgical weight, or to take their new knee. If their body mass index was just under, they got to 40, and I say, okay, now here's the thing though, you're still obese, you still got to lose weight. If you go on the carnivore diet and walk and lift weights, you could have a whole new you. And I'm kind of, you know, happy to be showing them through example, because I mean, my patients have seen me. I'm 43 pounds, plus I've gained some muscle. I know I have because I'm doing reps of higher weight in the gym and I'm working out pretty much like I always was. I'm riding my bike a little less, but I'm showing the patients, listen, you can do it, because if I can do it, you can do it. And it's really broadened out my entire approach to my patients. I now give my patients, even if they're not obese, they get probiotics and they get essential amino acids before their surgeries because this has been shown in the literature to the probiotics have all kinds of things that are helped in the perioperative time frame, which is the time around before and after the operation. Probiotics reduce mental fog. They reduce um, infections. They can reduce uh, other kinds of complications, reduce pain medication needs. And the essential amino acids have been shown to reduce the amount of wasting that the thigh muscles go through after a knee replacement. So I'm using my clinic now as a point of contact, not just for surgical patients, but for non-surgical patients to promote carnivore diet if they need it, or overall metabolic health with the essential amino acids and the probiotics. I actually sent off my gastrointestinal contents for a sample to be looked at by a lab, and they sent it back and they said it's pretty good. Now this was I stopped taking probiotics when I started the carnivore diet because I wanted to check a few months in, well, what is my gastrointestinal flora going to look like? The bacteria that live in your gut. There's trillions of bacteria in your gut, hundreds of different species. We don't even know them all, but we know the important ones. And so so the research that I had been doing showed that lactobacillus and bifidobacterium were the ones that can help bone health and can also um, help arthritis and help around the time of operation. And so I sent off my own sample, and they came back and said, Your gut health is pretty good, but you could use some bifidobacterium and some lactobacillus." So it's just amazing. And as I'm going through all this, I'm sort of my own N of one, like many people are. And I'm super enthused. I my I thought I was only going to be able to operate and perform surgery for another 4 years or so, and now I think 8 for sure, maybe even longer, because I was just worn down. I just think I couldn't imagine that I could continue to perform surgery for more than 4 or 5 more years in the health condition that I was in, and now it's essentially limitless. I say 8 more years, but I feel like if I feel like this in 8 years, I'm gonna probably do 8 more. And so it's just changed every facet of my life, and I've become totally convinced that the carnivore diet is that you can't argue that it's a vehicle to health. Whether or not doing carnivore for the rest of someone's life is a good idea for that individual person, those are individualized um, uh, those are individualized circumstances that I don't really know. What I can tell you 100% is that in obese, stressed, tired 54-year-old orthopedic surgeons, carnivore diet changes everything. And the thing that I found really interesting watching your channel is there are so you had some people on that have had musculoskeletal conditions, shoulders or knees, and even your own knee. If I recall correctly, you have bone on bone arthritis, and your pain more or less disappeared when you got on the carnivore diet, unless I'm mistaken in my
Yeah, that's
memory of
right.
that. Yeah. So, interesting thing is you're in a very unique position because you have contact details for all these people. And I think it would be just amazing for you to go back annually and check in and see who has done who has kept things going a year later. And there is look, that's not scientific evidence, but anecdote is pretty strong too. I mean, it's most dietary research is extremely flawed. For instance, if you look at the Harvard Red Meat Study, and I'm going to actually reach out to one of the scientists there and talk to him about it. And their email is on that study, and I'm going to email him. My problem is not with the study's methodology. My problem is with the data. And the data on the Harvard Red Meat study is from the nurses. It's called the Nurses Health Questionnaire, and they've been given that out. It's part of the Framingham Health Study, and I think it is part of it. But I know that they said in this study, because I actually read that I actually paid $35 to get access to this Harvard Red Meat study, because I want to know, is red meat going to cause diabetes for me? I don't know how that's possible. I mean, given that my physiology has improved tremendously by eating almost nothing but red meat and some eggs. And I found that when you look at the questionnaire, red meat is not measured in any way. Did you eat red meat? Okay, but they say a casserole. Did you have it in a casserole? So to me, if you had hamburger helper, you had red meat according to this study. If you had lasagna, you had red meat according to this study. So even if the methodological aspects of the study are strong, and I don't doubt that they are, the underlying data that they're using is so flawed. And and I don't know how they can recover from having flawed data. I don't know how you can say red meat certain times a week. I mean, is that 3 ounces or is it 16? Is it a ribeye or is it hamburger helper with a little bit of ground beef in it? It's just is it a chili dog with 50 kinds of different toppings on it and a bag of Doritos? I mean, is that your red meat? So
It's
it's
kind
just
of
completely.
garbage in, garbage out, right?
Well, that's what exactly right. I actually thought that myself. I said, this is right out of what the software engineers say, garbage in, garbage out. You can't tell me that red meat causes diabetes if the foundational data you're working with is highly flawed. And so I look at those kind of things, and I realize that the anecdotal stuff, especially when it's so prolific, is important. And that's why I think you have a unique opportunity, because you do so many. I don't think anybody out there is doing as many interviews as you are. It's shocking how many you get. But if you can go back a year later, and I think you got to go back and interview people for whom it failed and people for whom it didn't, and just get a sense of where are these people in a year. But I think it's a neat opportunity for you, to kind of become your own sort of less than perfectly rigorous scientific study. But yeah, so carnivore transformed my health, and carnivore transformed my life. I never ever thought of having a YouTube channel, but then I said, there's a few things here that I could do. If I get a YouTube channel, number one, I started a month ago. I have like 110 subscribers. I'm pretty small, but that's 110 people that are waiting to see if I'm going to make this work or not. Right. And so hopefully that'll grow. And then there's, maybe 200, 500, however many I get, there's people who are looking to see how I'm doing on the diet over time. And so that I'm kind of unique, I think, in channels, because it's like you either have a weight loss channel or you have a doctor channel. And you don't have a lot of doctors who are going through the actual process of transforming their life on carnivore right now in real time. If they're out there, I haven't seen them. You look at some of the doctors. I mean, Chafee has been looking the way he looked long before he did the carnivore diet, and you know, Saladino, well, he decided that you should eat a lot of carbs. But those guys, you just look at them, and they're world class athletes. I mean, there's pictures on my on my YouTube channel. I mean, I was obese, not looking good, and so that's kind of unique. But I've really embraced looking into how can I help people, and I really think that when I do stop operating, I'm going to try to set up an obesity clinic at some point. I mean, there's a point in your life where the operating is just too stressful. I know I have 8 more years in me, but after that 8 years, I'll be 62. I may think that, okay, it's enough, because it is very stressful. But it's just opened this whole new door. I mean, I may see if I can go up and do a year with Dr. Westman at Duke or something, and do some kind of a fellowship or something. And then, I mean, I'm just so enthused about the possibility for these people who have been my patients who have been just hopeless. I have them right now, and I am recommending carnivore to them, but it's not the same. I don't feel like I'm qualified at this point to say, okay, come back in 3 months and I'm going to check your labs. And I certainly can't fill up my clinic with people who are coming in for weight checks. I mean, that's just not, you can't run an orthopedic practice that way. So I kind of have to use their own doctors as sort of conduits to help them with their care and say, listen, here's a diet. You know, I just did a surgery on a guy who had an issue with his leg, and he's very, very overweight, and I got his primary care doctor on board, and so I'm texting him from my personal cell phone saying, "You can do this, you can do this." And so there's just a thrill. There's a thrill when I see that I can help people. That's why I got into medicine in the first place. And as much as the transformations are in orthopedics by giving someone a new shoulder or a new knee, of course, you know, these are oftentimes woven in with complete life transformations. I used to tell people, I mean, I remember a guy a few years ago, I said, "You got to lose 100 pounds." And he said, "Okay." And he walked out, and I thought, well, I'm never going to see him again. And he came back a year later, 100 pounds down. I did both of his knees sequentially, about 6 weeks apart. And 3.5 months after that, he started walking up the 14ers, they call them in Colorado, the 14,000 foot mountains in Colorado. They have walking trails, not aggressive hiking, but just completely transformed his life. And I'm as excited about the weight loss aspect that I played a part. And all he did is he went and found this other thing called Optivia, which is sort of like a supervised weight loss and all that. And he, totally transformed his life. Well, I would love to, as my as the surgical portion of my career ends. I mean, I want to be 62, and unless something turns around, I'm going to be healthy and feeling like I'm 50. and and I'm going to be wanting to help people. And so I think an obesity clinic is somewhere off in the future for me. And in the meantime, I'm going to try to share information with people on my YouTube channel. Like, I just put up a 5 supplements you can take on carnivore, and that seemed to be very well received. It's my biggest video. Yeah, like 1,500 views. It's not much, but so I found that people are looking for, actionable advice, and I'm always very, very careful. I don't want, I'm super careful with anything that I recommend, so that it's completely 100% backed by science and really as non-controversial as it can be, albeit within the framework of maybe the most controversial diet um, that exists on the planet right now. Because you have people who are morally uh, hurt by the fact that we kill animals to eat them, and so those people, like the plant chompers guy, seems like a nice guy. He's a little bit out of his lane doing all the nutrition stuff, as he's an earth scientist, but underlying, he's a vegan, and he thinks that global warming is going to destroy the planet and that cows are a major part of that. So another facet of my channel is going to be going to regenerative ranches and showing how good they can be for the environment, and how, you know, if you look at a heavily chemical based row crop farm versus a regenerative agriculture beef farm, I mean, you're going to look and you're going to see that the one is plainly better for the environment than the other. The carnivore diet is nested in so many different aspects of how I'm operating in the world, and just how the world is operating, because the carnivore diet people who are adherents of the carnivore diet know exactly how bad for you the big food industry is. Like when I s- when I see people that are on the carnivore diet talk, they're already not eating Doritos. Okay, that even you know even the people who are going to eat some hot dogs, they still understand that uh, all of this processed food, these processed grains that where they have scientists just sitting around desks trying to figure out how addictive they can make this horrible, worse than non-nutritious, anti-nutritious food, how they can make this taste so good that you just want more. And they even brag about it. Nobody can eat just one, right? And so carnivore is part of a battle against against I think a medical system that's broken, a food system that's broken, and a misplaced environmental stance, and with respect to meat being bad for the environment. I think all those things are nested in the carnivore diet, and by being carnivore, you are on the side of health and on the side of these farmers that are doing their best to be gentle on the earth and still have agriculture. And so it's really an amazing amalgamation of just so many different factors that it's exciting because it's not just a diet that's about weight loss. It's certainly a lifestyle. There's no way around that. Carnivore is a lifestyle. And there's a lot of planning that it takes, and sometimes, you have to just go with the flow, and sometimes I'll eat hot dogs if I'm at a track meet and they have hot dogs, I just won't put ketchup or buns on them, and I'll eat hot dogs. But going through life as a carnivore, it's a lifestyle. And for me, I said on my channel when I started, I said, "I'm gonna do carnivore for 6 months." Well, I'm coming up on 6 months. Coming up on 5. But I already know how good I feel, and I'm gonna do carnivore for the first year. And then I've proposed to myself that, well, then maybe I'll cycle through some keto, and add things back in and see what works. Add in the first thing I can't wait to add back in is cheese, um, and add some things back in and see if that works. And then, but here's the thing, carnivore is always there. If I go back into keto and I gain 10 pounds, I just go back carnivore. It's like the keys to the kingdom. Like, here's a thing that works that I can do. I mean, all of those things I mentioned earlier, they work, but I can't do them. Certainly not on the long term. But I'm telling you right now, I can go carnivore at any point in my life and stick with it for a long time. And if I get a little bit off track, I know that I can always come back to carnivore, and it's just waiting there to heal me with perfect nutrition. At least that's what it seems right now. So,
Yeah. Well, first, just to talk about your situation, um, how have you been eating for the last 4.5 months? Are you on a 1 to 2 meals a day, or?
yep, yep. I eat typically 2 meals a day. I'll eat a little bit. I usually have some grass-fed beef sticks around noon or 1, and sometimes maybe it's salami. Uh, but usually I try to stick to beef as much as I can. I don't know. I hear that people do better on ruminant meat, so I try to stick to that. And then I typically will have either a ribeye or a bowl of red meat with a couple eggs on it for dinner and some salt, and that's it. I've had a little bit. I've the cheats that I've had a little piece of cheese here and there, but I've not, gone totally overboard and uh, out of line. I mean, some people eat cheese on a carnivore diet. I don't. I chose not to. I do have heavy whipping cream in my coffee because I love coffee, and it's helping me get through this whole. It's helping me make this conversion, if you will. So so yeah, it's basically been meat, eggs, salt, and heavy cream, and that's it, and just couple little cheats of cheese.
So
So
this must have been like a whirlwind 4.5 months, not only for you, but for your family as well. Because
yeah.
they've gone from complaining about your snoring to having you, I guess, dance around the house full of energy, suddenly making YouTube videos and like preparing, I guess, preparing your own meals at weird times of the day. Like, how is
Yeah.
this all working at home?
It's been a lot. So first of all, every day there's something from Amazon for me to, a new microphone or something like that. And my girls play volleyball, and I've been making all kinds of videos, and I learned how to video edit. So I've been making a lot of volleyball films, and I've filmed my daughter playing piano. So it's like been this sort of filmmaking and carnivore whirlwind in my house for sure. It's been crazy. But my wife, you know, I mean, she looks at me and she's like, I mean, that's working. I mean, she's never. I look better than I did on my wedding day by a long shot. Um, I probably look as good as we met when I was 28. And so she's super happy with it. Now, here's the navigation. My daughter, one daughter loves to bake sugar foods, and my other daughter loves to eat sugar foods. My wife is, decent with her diet, but the kids are in, and so one of my big regrets is that this didn't happen, you know, 17 years ago before my kids were born, and I could have brought them up in a much stricter food environment. But now if they go to a sleepover, the mom at the other end is probably going to take them for boba or make them cookies. So we're in this terrible sugar environment, and so I don't. They know exactly where I stand on sugar, and I do tell them, hey, you're eating poison. And so my hope for my kids is that when they do get to the point where they're not kids anymore and their bodies start to, well, my ultimate hope would be if they could mm, if they could take their diets to a better place now. But we're just so far behind the eight ball that I don't think that that's possible. But they're seeing what it's doing for me, and so when they do run into trouble, hopefully they'll be able to make the adjustment, and they'll know that carnivore is there for them and that keto is there for them. And so yeah, it's been tough. I'm gonna do some different things. I always try to let them know, there are other ways. I just anything I can do to move the needle for them, I'm trying to do. I have a friend whose wife has this company called Batch Balanced, and she makes muffins for her kids with almond flour and oat flour and a lot of protein and not a lot of sugar in them. And so I'm like, well, we can try those, and anything that can move the needle in that direction. But yeah, it's been a whirlwind. But I mean, I used to come home and nap. I would come home from work and I would nap. And on the weekends, I would nap. Now, I still don't mind sometimes a nice Sunday afternoon nap. I am 54. But I mean, they see me on my bike. They see me out working in the yard. They see me when I'm videoing their volleyball. I mean, I'm running around with a 10-pound camera rig all day long. And they just see me as a different, more vibrant person than I was January 1st of this year. And so, yeah, it has been a whirlwind for sure.
Yeah. Wow. So in the last 6 weeks, you've been sharing this with patients. What kind of reception have you had from patients?
That's a great question. So some of the patients say, I couldn't even begin to try that. I hate meat. And I say, okay, but you could do keto. If they don't want to do carnivore, I try to say, well, how about keto? And if they say, no, 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 I can't do that, I say, well, I mean, anything you can do. So I have my uncle and my aunt are have last I talked to him about a month ago had both been on tirzepatide for several months, and my aunt changed her diet and my uncle didn't. And so she lost 40 pounds and looks great, and he hadn't lost the weight yet. So what that tells me is there's a lot of different ways to do it, but you got to fix the diet. No matter what you're doing, you got to fix the diet. So when my patients say they can't even fathom doing carnivore, I say my next go-to is keto. Well, could you do keto? Even though I know keto is a lot harder. And for people on the fence, I say, listen, the reason carnivore works so well is because it's so simple. It's not easy, but it's simple. What am I eating? I'm eating meat, maybe eggs. That's it. And if you want to do cheese, right? A lot of people do. So it's been well received. I think a lot of my patients feel like when I had a woman who came to me today who was very overweight and she had an injury. And I spent more time talking about her weight and her health and what she could do with it than I did talking about her injury. I think she appreciated it tremendously because she knows I care. You're not just in my clinic, you're not just a knee moving through that I get to operate. You're a whole person that I can help. And my help, I don't want it just to be limited to the knee. Now, I'm not going to try to tell people how to manage their blood pressure, but if they're obese, I'm going to speak to them about how they can maybe turn the corner. And so I think overall it's been well received, and certainly the metabolic aspect of it, telling my patients about the essential amino acids and the probiotics around the time of surgery and telling them about the research, and they're 201, they say, "Oh, absolutely," because it makes sense. When I was trained, nobody, all we ever learned was how do we replace this knee? How do we fix this fracture in my residency? Nobody ever said to me, "Hey, Dr. Godding, make sure you make that patient as optimal as they can be physiologically and metabolically for that operation." And so now I'm trying to do that, and it is recognized and appreciated by the patients.
So, on your practice, do you focus mostly on joint replacements, or do you find yourself doing like limb removals for people that have got serious diabetes complications?
So I've done a fair amount of limb removals over time. I haven't in my current practice. I did a fellowship in shoulder and knee surgery in Australia, and I practice mostly shoulder and knee surgery. But in the hospital setting where I am, I also take care of a lot of fractures. I don't do hip replacements anymore. I only focus on the shoulder and knee, and that's because that was my training and my interest. Um, and what I'm really interested to find out is what like rotator cuff pathology. So the rotator cuff is the tendons that move the shoulder deep inside the shoulder. The muscle you can touch, this is your deltoid. Deep down inside is your rotator cuff. I wonder how metabolic health affects the rotator cuff, and I would love to figure out a way to start trying to approach that, but I don't know how. But I think going into the future, people are going to have to figure that out because we know that the reason that the rotator cuff tears is usually not trauma. It's usually a lack of nutrition to the rotator cuff because of the type of blood supply that it has, not necessarily because you have one or repetitive trauma. Now, that does occur and that can cause rotator cuff tears, but we know that the blood supply to where the part where the tendon hits the bone, we know that there's a compromise in the way that nutrients are exchanged there, and that's why that most 90% of rotator cuffs are in the same place. And so I'm thinking, well, gosh, what's the metabolic angle on that? And so, I joined the metabolic initiative and I did their last CME, and I'm learning all these things, and I'm just it's been a fire hose. It's been a crazy 4-month fire hose of starting a YouTube channel, losing weight, and doing a bunch of continuing medical education and breaking out my old physiology books and my biochemistry books and listening to lectures and trying to just educate myself on all of these things at once. So it, it's been pretty crazy, but I'm excited about it, and I'm more enthused and energetic than I've been at any other time in my career, for sure.
Do you do you think the tide is turning in the medical profession? Do you think there's a gradual movement of people understanding that, metabolic health plays a much more important role in things than was ever thought before?
100%. I think it used to be that, you know, everybody kind of bought the line we were given in medical school, and you don't really think about it in medical school. Yeah, we were just so happy to be there. It's such a thing, like, oh, I got into medical school. This is my dream, and here I am with all these other people, and we all want to be doctors, and we're here with, you know, all these brilliant professors teaching us stuff. And it didn't really occur to us, hey, they're basically teaching us how to give name brand medications to people, and you know so there was a little bit of that at the beginning, but now I think what people have seen is that I think YouTube's been a huge part of it. And I think because people have if doctors have not paid any attention to the fact that people are getting healthy through diet in a way that literally in medical school they told me you couldn't cure type 2 diabetes. This is a disease with no cure. You're just going to manage it. And it's just not true. And I don't wanna say that anybody lied, and I don't I wanna be careful not to say, "Oh, I was lied to in medical school." The people who taught me in medical school were of the highest ethics, and they were brilliant, compassionate people, but they were caught in a system that had crowded out a lot of natural remedies, and we were kinda taught to scoff at, um, you know, functional medicine and things like that. But see, so when I did my internship in Hawaii, and then I went back and practiced there for 10 years and on the island of Kauai. If you're on Kauai and you start saying that, things like chiropractic and acupuncture and things like that are bunk, you're not going to be very popular because that island is very much into it. Even, and the Hawaiian, when I was an intern in Honolulu, you could prescribe Hawaiian touch and they would have uh, uh, a Hawaiian elder who had a whatever certain type of training within the Hawaiian community, and they would come and do healing touch on people, and it helped. And so, if you weren't open to that, you weren't going to be successful, at least on Kauai. But to answer your question more directly, I think there is a huge swing right now. I think physicians are so disappointed with the system and where it is. And, for me, I this is my 20th year of practice, and physicians were starting to get disgruntled. I can remember my chairman of orthopedics back in medical school. He said, you guys have already missed what medicine should be. And what it is right now is okay, but in 20 years, it's going to be a disaster. And, he was very prescient because, you know, it's 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 a system that's broken in so many ways that's an entire different, podcast. And the food system as well. So I think there is recognition on the part of doctors. I think the tide is changing for sure, and I do have hope for the future because I do think that the more people focus in on metabolic health and stop being so siloed into their own little organ system, right? I mean, like my cardiologist telling me, just keep doing what you're doing. And I was sick and he, great cardiologist, v- very brilliant, but doing exactly what the American College of Cardiology tells him to do and not servicing me as a whole patient at all. And so, I think that there is that recognition coming, and I hope that it continues. But it's a juggernaut. The system is a juggernaut, and the system writes the rules and has the money. And but I do have hope for the future for sure.
Can you talk a little bit about your YouTube channel? What kind of videos have you got up there, and how can we find you?
Sure. So it's Dr. Rick. Easiest thing to do if you want to find me on YouTube is just type in Dr. Rick Carnivore. It's at Dr. Rick Goding. That's RickGoding. But nobody can remember. Everybody puts two O's or two D's. So if you just put Dr. Rick Carnivore, you will get there. So I only have about 10 videos because I started my first video. I went to New York, to Long Island, to my friend's 50th birthday, and I said, "Well, come along with me, and we'll see if we can stay carnivore in New York." And I went all through New York City, and I actually ended up eating at the steakhouse where Jordan Peterson eats when he's there, and just how I maintained carnivore 1 month in on my first real test. And I have a couple of these kind of travel videos. I have the 5 supplements video. I just made a video the other day because a lot of there was a bunch of videos coming out. There was a new study showing that cavemen were vegans or whatever, and I kind of went over how unimportant that really is and how nonsensical the whole concept is of trying to figure out what our Paleolithic ancestors ate. I mean, here we are today, let's eat. But yeah, so there's only 9 or 10 videos, or maybe 11. I'm putting one out every week. I'm going to try to put 2 out every week. I try to make them entertaining. I try to make them informative. My little tagline is inform, educate, inspire. I want to inspire people to be healthier. I want to inform them and educate them on different aspects of the carnivore diet and ketogenic diet, and eventually, the more I understand things, the more I will translate them. It's a translation. I'm trying to translate, because you'll find even the docs who try really hard, like even like Dr. Barry, who try really hard, he slips into medical lingo, and I'm thinking to myself, yeah, if I wasn't a doctor, I wouldn't understand what he just said. So I just try really hard to try to keep it in as plain a language as I can and just translate things. So yeah.
Nice. Well, and sorry, I'm laughing there when you were talking about that study. I'm imagining a caveman hunting down some balsamic vinegar to put on their salad. So
Yeah.
I'll link to your channel in the show notes.
Thank you.
Um, Dr. Rick, I really appreciate you coming on and sharing your story with us. Thank you so much.
I really appreciate the opportunity. Thank you very much, Dave.